This illustration came about as a result of a prospect who had been calling on for some time, and one day the owner of the company happened to be at the front desk when I called, and he said, we've looked at a group 3 or 4 times over the past 15 years, and we've just come to the conclusion that it's not something that we can afford for our company and our employees. And that was the first time I had met the owner. I asked him, if you gave the employee $1 and it was tax-free to the employee, and you were able to tax deduct that from your company, would the employee be better off before or after you gave him the $1? And obviously he said, after we gave him the $1. It seems to me that you had some amount you felt you could afford because you wouldn't have gone to the market in the first place. So why don't you just give your employees that amount? Because it'll be tax-free to the employee, and you can deduct it just like you can deduct wages. And he basically said, let's get together. So this illustration came as a result of putting some stuff together for them. We need a sample employee to work on here, so we'll use a $45,000 a year income for one of his employees, and the standard 37 hours a week and 48 weeks a year because they're a long-time employee, and the income would be $25.34. So we want to use a typical pay increase to illustrate our point. So I'll use some information from a survey done by Culpeper based on salary increases in Canada. Their survey said that base salary increases in Canada are projected to rise from 2.26% in 2010 to 2.83% in 2011. So let's give our sample employee a raise, and we'll give him 2.83%. $1,274 or 72 cents an hour of an annual increase. So for our illustration purposes, let's give our sample employee a 70-cent raise. That happens to be $1,243 that they would get that they would be entitled to for their annual raise. We need to account for taxes when we're considering the employer's total cost of giving that employee a raise. So let's do that now. They would have CPP of 4.95%. They would have EI of 2.49%. Workers' compensation could be as high as 17.51%. Holiday pay of 8%. And if their payroll was over $400,000 a year, there'd be a 1.95% Ontario health tax. Now your numbers may be a little bit different. Your workers' comp may be not as high, or an employee could be just a new one which only qualified for 2-week holiday, so that may be less than 8%. In our illustration, the total employer tax comes out to 34.9%, or $434, bringing the total cost for the employer up from $1,243 to $1,677. Now there's also an impact to the employee, and let's look at that tax impact now. The employee also has the employee portion of CPP, which is also 4.95%, their portion of EI, which is 1.73%, and the marginal rate of tax on a $45,000 income would be 31.15%. So the employee tax comes up to 37.83% or $470, taking the spendable income down for that employee from $1,243 to $773, which is basically a loss to the employee of $470, just lost in taxes. So that's the tax structure on an annual increase of $1,243 given to the employee as a raise. So let's look at the difference when it's given to the employee as a health account. One thing you notice right away is there's no tax due on this on behalf of the employer, and similarly there's no tax to be paid by the employee. So the employee winds up receiving $1,243, the owner winds up paying $1,243, and the increase given was actually $1,243. The employee gets 100% of what it costs the owner. This is particularly advantageous to a company that has no benefits in place right now and really desires to put something in place but can't afford the heavy premium costs, or doesn't feel that what they're getting for the premium dollar is much of an advantage for the employee. Now, it's important to realize that this is just an example. There are places for each kind of benefit, so make sure you do your own due diligence and look at your situation before making a decision. There is a disadvantage to a health account, a pure health account, that the employee might want to take care of, and that is the fact that a health account is capped at whatever the employer wants to give that employee, which is in this case $1,243. So if they had a major problem that with more expenses than $1,243, they might want to consider getting catastrophic coverage to cover major expenses for the employee. That can be obtained through Blue Cross or Manulife or a couple of other companies that have standalone products. If you have a larger number of employees, there is group coverage available for that situation. We encourage you to do your own due diligence and check things out for yourself. And if you find that there's an advantage there for you, just get in touch with your agent or your financial advisor, or give us a call at InsureCare, and we'd be happy to help you take care of that. Thank you for listening, and bye for now.